You can proceed, sir.
So we can start like the simplest condition like low backache. Very commonly, people comes with the complaint of low backache. So simplest low backache even extends up to the surgical intervention. Or we have condition like arthritis very commonly. So a different set of arthritis are there. So where we can manage them effectively. So for example, if you take low backache, very commonly we'll understand Katishula or Katigraha or Gridrasi. So those conditions we can manage effectively. For example, depending on the condition, the chronicity, severity, and structural damage or structural involvement, we can change the treatment modality. For example, very simplest procedures we can start from the Valaka Sveda, which is very simplest thing. Valaka Sveda, Chuna Pinda Sveda, range of the Svedas are there, which are very easily applicable, very minimal instrumentation, very minimal the materials are necessary, cost effective. Such things can be adopted in the clinical practice. For example, if a patient comes with an history of Katishula since 2 days or acute the low backache, for example, yesterday he slept, next day morning suddenly he got severe low backache with stiffness, that can be effectively managed with the Valocas rather than giving analgesics or other than giving any muscle relaxants. We can manage effectively with Valokasveda, where we understand in Ayurveda there is association of the kapha and muscular spasm will be there. So that can be very effectively managed by the simplest and economical treatment modality like Valokasveda, where the very simplest thing is we can take the similar size of the Valuka or the sand, just fry it, warm it, then prepare a potli or the bolus. Then you give the fermentation where it comes under the Rukshasveda, because usually whenever there is a Kapha association, we have to go for the Rukshasveda. So you adopt the Valokasveda locally because this is a Sthanika Sveda we call it as. So locally we can adopt it. So usually patient feel comfortable and relief. Of course, we can have some internal medications also we can give for the Vatanlomana purpose or the if Agni disturbance is there, that Agni also has to be corrected. But externally, very simplest in the OPD level also, no need of droni or no need of other instrumentation. Very common table, we can adopt the such kind of procedure like Volkasveda. So next thing, even we have another procedure called as Chuna Pindasveda, where we'll have some medicated chunas. So that can be fried or the warmed or the pan, then prepare a pottery, then you adopt for the Sveda. Locally, it also comes under the Ruksha Sveda, so where it also effectively manages whenever there is a swelling or even there is a kapha association, stiffness is there because of the kapha association, that time very effectively it can be managed. It's very simplest procedure. For 15 to 20 minutes you can perform for 7 days or 8 days, as it is local the Sweda. So you cannot expect the Samex, Swina Lakshana, all those things are not necessary because you know that domestically people will do such things. They will only go for the hot water bag fermentation, or they will use the Lavana Potali Sweda usually. They will effectively adopt in the effectively they will manage, but we can scientifically apply in the clinical practice at the OPD level so that patient feels comfortable and results will be there. So even that also can be adopted. So such kind of conditions are there where you can adopt very simplest procedure as I mentioned. So any such things are there we can discuss.
Sir, how each procedure can be easily adopted at the level of OPD, sir? Vamana is there, Virachana is there, but as Svedana, you said, Ruksha Svedana, it can be done with the Churna and the Valuka. But what about other procedures, sir? How best we can use and how easily we can use it, sir? What are the ways that we can adopt?
So commonly we can adopt at the OPD level. The most of the, as I mentioned, Bahas, Bahirparmarjan Chikitsa, like Payasneha and of course Vedanas. So we can easily adopt those things, except like Shodhana procedures, Vamana, Virechana. Virechana also can be adopted, but we'll leave it, we'll discuss afterwards. But majorly all the Bahirparmarjana procedures, if you comes for the question of Snehana, in this Snehana we have popular, very commonly practicable procedures are like Katipasti, Janabasti, Grivabasti. Even we are very happy that nowadays people are having familiarness with these procedures and they only comes to ask us that we need Katipasti, sir, we need Grivabasti because I have the problem with the lumbar region. Like that much familiarness is came in the society. So such procedures like Katibasti, Grivabasti and Janabasti can be easily adoptable. One thing. So that because no much thing is there, only thyla is required and we can have now steel rings or fiber rings also available so that you can fix it, and warm thyla has to be poured in that. Only we have to take care about the temperature of the thyla, and uniform temperature has to be maintained throughout the procedure. That is very important. And another important thing in such condition is that as it is a localized treatment, you should be particular about the where the pathology is there, where the actual lesion is there. For example, if it is at the L4, L5, you have to place over it only. If it is at the level of L2, L3, means you recognize it, you identify it, then place over particular part of the thing. And the question comes about the selection of the Snehadravya or the Thaila. So we have many range of Thailas. We have Kutumchikadi Thaila, we have Dhanvantara Taila, we have Kshirabala Taila, we have Savacharadi Taila. For example, I am speaking. So we have to decide on the basis that if, for example, a patient comes with an history of low backache, acute, but there is a association of the stiffness, that time we usually select Vata Kafara, means generally or at the very minimal Sama condition is there, better selection will be Kottumchikadi Taila. If it is, we expect that degenerative changes are there in the radiological investigations, our ES factor is also supports for that. That time we are expecting Brahmana effect, nourishing effect. That time we can go for the Mahamasha Taila or even Dhanvantara Taila, also Brahmana in nature. If any traumatic history is there, for example, any patient had a history of trauma, because of trauma he developed backache, and in the radiological investigations also it supports. That time we can have Dhanvantara Tela, or even popularly known as Muruvena can be adopted for the Katibasti. So this kind of Taila helps for the particular involvement of the dosha also can be maintained, and what you are expecting, whether you are expecting only Shotahara effect or you are expecting nourishing effect. So depending on that, you have to select the Snehadravyas. The same thing in the Grivabasti also. For example, another very commonest condition which usually patient comes with to the Ayurveda is cervical spondylosis. If there is a degenerative changes in the cervical level, the radiculopathy will be there in the upper limbs. That time usually patient comes with history. At the OPD level, easily we can manage such things with the Grivabasti, where patient will be lie down prone position, or even patient can be sit and he can just forward bend forward so that his cervical area can be exposed comfortably. Over the cervical area where the actual lesion or the pathology is there, at the which nerve root it is there, it has to be identified, and then you place a brim. So usually we'll use the masha floor, but very easiest thing is you can use the instrumentation like the steel ring or the fiber things. Easily you can fix it, then pour the Taila, Sneha Dravya. But there is a selection of the Taila mind slot in the such procedures once again. So for example, if it is cervical pathology, usually we can select Carpusastadi Taila, then Kottumchikadi Taila, and Dhanvantara Taila, and even Parinita Keri Kshiradi Taila. So very common thing is we can have Carpusastadi Taila, Prasarinyadi Taila for the cervical pathology, because Kottumchikadi also same thing as we discussed earlier in the Katishula or the Grudrasi. So if it is stiffness is associated, better to select Kottumchikadi. For example, if it is just out of the Sama condition, So better select the Kottumchikadi, don't go for Brahmana suddenly. So only thing you have to take care in the Panchakarma is you analyze the Sama and Nirama. It is very important thing. For example, if it is Sama condition, Sama means the patient is having huge stiffness, Agni disturbance, like he or she is associated with the loss of appetite or indigestion, improper metabolism, you are appreciating in the patient or swelling is there, that time don't go for the Brahmana suddenly. For example, if you wrongly select Mahamasha Taila or suddenly you select Prasarnadi Taila, Prasarnadi Taila is also Brahmana in nature. So that kind of Taila should not be selected. So early you select the Tailas like which is little Ruksha in nature. Even though it is Sneha, it is Kafara and Ruksha in nature. For example, best thing is Kottumchikadi Taila. That kind of the Sneha has to be selected. So if it is purely degenerative and needs nourishing effect, that time you can go for the Mahamasha Taila, or better selection is Karpasatyadi Taila and Prasarnyadi Taila in the cervical pathology. So like this, you can change the Sneha Dravya for 7 days, 14 days, you can perform it. So depending on the patient improvement and patient condition, age factor, their comfortability to receive the procedure, everything counts there. And with this, once again, internal medication can be given, what actually the pathology is. So you can comfortably relieve it. And you can go for the Sthanika Abhyanga also with this. After these procedures, you can do the Sthanika, local Abhyanga can be done so that still better effect will be there. So next thing in these conditions is Patra Potli Sveda, another very simplest procedure, but it needs little preparation. So we call it as very commonly Patra Potli Sveda. That also can be adopted. Patra Potli Sveda is very effective pain management procedure, like in Gridrasi, Sandhigata Vata, like osteoarthritis, and even cervical pathology. Patra Potli Sveda can be adopted because it is having Snigdha and Vata Kafara nature. So Patrapotli Sveda is another very important OPD level practicing procedure which can effectively manage the neurological and musculoskeletal conditions. So Patrapotli Sveda, generally what happens, we select some patras, so they will be mixed with the lemon pieces, then coconut, grated coconut, then some chunas, Vadhara chunas, and then taila will be there. That will be fried and mixed together, and we'll prepare the potali. In this, all the dravyas like madhurasa, amla rasa, and even lavana, saindava lavana is added. Together we are mixing properly and potli is prepared. So that also can be easily adopted. And another, the positive thing of the Patra Potli Sveda is once you prepare the potali, that can be used for minimum 3 days you can use. So next you can prepare the fresh potali. Means at the OPD level easily it can be prepared, and for 3 days you can use same potali. You warm it and perform the Patra potli. Same in the cervical pathology and even the lumbar pathologies and osteoarthritis. Very common osteoarthritis is knee osteoarthritis like Sandhigata Vata. This is another procedure. So here also first thing is directly don't go for the Patra Potli Sveda because it is Snigdha in nature, not totally Snigdha. It is Snigdha and Ruksha. Like you can have 75 and 25%. Valuka Sveda is totally Ruksha in nature. Chuna Pinda Sveda is Ruksha in nature. But you have to go for in the Sama conditions. First line of the Ruksha. So then you can switch on to the Snigdha so that the worsening of the condition will be prevented. For example, if it is Sama condition, wrongly if we select Brahmana line of the treatment, that condition worsens, Shota increases, swelling increases, stiffness increases, pain increases, warmness increases. There is every chance of aggravation or the worsening of the condition. That's why you should be very carefully bother about these such things in the Panchakarma, that whether it is Sama or Nirama. So two things are there, very basic things in the Panchakarma is Ruksha and Snigdha. These two things should be carefully understood. Where we have to go for the Ruksha, in which condition we have to go for the Snigdha. So Ruksha is very necessary whenever there is a Kaphaja dominancy or association of the Kapha is there. So whenever there is a Kevala Vata condition, after the status of the Sama is came out, that time you can go for the Snigdha treatment. So that's why Patraputli also can be adopted in the later stages in such kinds of the pathologies. And another thing is we can go for the cystic Shali a bit difficult because it needs a lot of the preparation at the OPD level. But commonly we heard cystic Shali it is highly Brahmana in nature, which is usually can be adopted in the lower motor neuron lesions, even in the stroke patients, where there is a spasticity is not there. Means whenever there is a flaccidity is there, whenever there is a hypotonicity is there, that kind of the conditions, cystic can be adopted. And very commonly in pediatric conditions like cerebral palsy, post poliomyelitis. Usually now poliomyelitis is not, incidence is not so much. But even if there is a traumatic history of the patient, they develop paraplegia because of the lumbar pathology. In such conditions, you can adopt the cystic because it is highly Brahmana in nature. It nourishes the at the mamsa, and even up to some extent Asti Dhatu can be nourished by the cystic Shalipindasveda. So very effectively you can treat the such conditions where it increases the muscle tone. So whenever there is a flaccidity, you have to adopt the cystic Shalipindasveda. For example, if the patient is having spasticity, hypertonicity of the muscle is there, or rigidity is there, that time usually don't go for suddenly cystic Shalipindasveda, because cystic Shalipindasveda increases the tone of the muscle. Once again, it worsens the spasticity. So in such conditions, once again, you have to go for the Rukshana first. You go for the Rukshana, so then you switch on to the cystic Shalipindasveda, better effect will be there. Even in the CP cerebral palsy conditions, also in the pediatric, suddenly don't go for the cystic Shalipindasveda. If you adopt the cystic Shalipindasveda in early stages, usually that child will develop the running nose or the cough, or even sometimes they will become feverish, or after 1 or 2 days they develop the fever also because of the sama and the snigdha if you wrongly adopted. So because usually cerebral palsy, the children will be having immunocompromised status because repeatedly they will prone to the upper respiratory tract infections. Very specifically in the winter season, you should be very careful because cystic Shali is a such a sweda which is generally Sita in nature, because cystic Shali is itself Sita in nature. So that's why it is very important. The temperature is minds lot in the cystic Shali. That is the reason why very commonest complication in the cystic Shali is the patient or person who is undergoing cystic Shali, they develops the shivering because it is Sita in nature. It is Madhura or Brahmana in nature, but it is Sita in nature. So you should be very carefully adopt cystic Shali. Temperature is very important factor in the cystic Shali. So temperature should be maintained uniformly. If you not maintaining temperature, suddenly patient develops the shivering. So that is another important point in the cystic Shalipindasveda. And next thing is at the OPD level, you can adopt the very simplest. Another thing is Urdhvartana. Urdhvartana is very simplest. In the normal table also you can perform. The very common people say that powder massage. Commonly the people say like that because we have some of the medicated chunas which will be applied over the body in the reverse direction, pratiloma gati, which facilitates the fat which is stagnantly retained subcutaneously that can be mobilized, and it brings the integrity of the structures of the body will be strengthened. So very commonly you can adopt very easily Urdhvartana, but it needs pressure effect. So we can adopt like Kolakula Chuna, very commonly will go for the Urdhvartana. You can go for the Haridradi Chuna or Trifala Chuna. Very commonest thing is even you can adopt the Trifala Chuna, Urdhvartana. So whenever you are going for the cystic Shalipindasveda, the better thing is primarily you go for the Urdhvartana 1 or 2, 3 days at least, so that wherever the ama is there, kapha is there, that will be removed. Then you switch on to the Brahmana like cystic Shalipindasveda, whether it is pediatric like what we discussed, cerebral palsy, or even lower motor neuron lesions like paraplegia. So you adopt Urdhvartana, then you switch on to the cystic Shalipindasveda, it will be very beneficial. So I think Urdhvartan also can be practiced at the OPD level on the normal table. And Staula cases are very common because especially in the woman they are more having concern about the weight and they are always looking towards the weighing machine. So in such people you can go for the thing. And another thing is in the prameha also, diabetes also, stula pramehi very specific way, which is kleda pradhana. There you can adopt the urdhvartana. So if you adopt urdhvartana, effectively you can increase the metabolism and the complications of the diabetes also can be reduced like neuropathy or they are feeling exhaustion early. So such symptoms can be reduced. They feel lightness after the Urdhvartana, they feel active, and even in turn their metabolism will be corrected. And that externally you can adopt the even Urdhvartana in the diabetes patient also. And another procedure you can adopt at the OPD level very easily is Istika Sveda. Usually the people comes with history of the plantar fasciitis or the calcaneal spur. Plantar fasciitis can be effectively, I think, managed by the Istika Sveda. Istika Sveda is very simplest procedure. At the OPD level, we can adopt. Istika is taken and it will be warmed. Over that, it is heated, not warmed, it is heated. Then it is placed in a vessel. Then over it, you can pour the dhanamla or the kanji. Very common thing is kanji or even ganji. You pour it hot ganji has to be poured on the that istika or the brick, red hot brick. Then ask the patient to take the fumes coming out of it towards the heel. So before that the patient has to undergo local sthanik abhyanga has to be done to the heel, so that after that the snehana they have to receive the that istika sweda. So whatever the fumes is coming out of the istika, that has to be received. Even you can go for the Dashimula Kashaya also can be poured. Dashimula Kashaya or Kanji or even Dhanyamla or Ganji also can be taken. Usually Amla Drava is more effective. And Dashimula as it is Sadhya Shulara and Vata Kapara in nature, Dashimula Kashaya can be taken. Just ask the patient to pour and towards that fumes he has to or she has to hold his heel, and that also effectively manages the calcium, sorry, very specifically plantar fasciitis. We call it as Vata Kantaka. It's very simplest procedure. And next thing is we have another procedures like Siropichu. I'm trying to simplify the procedures which are very easily can be effectively managed in the OPD level. Siropichu is another procedure where we can adopt the thyla has to be selected and a pichu or a cotton gauze piece has to be prepared, thickened. That can be placed over the anterior frontanale for 25 to 30 minutes, very specifically in the problems with the hair, like hair loss, graying of the hair, then insomnia, anidra, the psychological disturbance, and even in the children's pediatric conditions like CP cases, cerebral atrophy conditions in the old age. Old age people are complaining about the forgetfulness or confusion status, and even in the stroke patient also, hemiplegic conditions where they can sit comfortably. If the patient is able to sit on a chair you can conduct the Siropichu very easily in the OPD level. Just place a cotton gauze piece and dip in the warm thyla, recommended thyla, place over the anterior frontanale for 30 minutes. So it will create a lot of the changes because it is directly having relation with the Mastishka, like we call it as Murdini Thaila or Mugni Thaila. We have four things as we know that Siro Pichu, Siro Benga, Siro Basti, and Siro Dhara. Because Dhara and other thing is difficult to conduct at the OPD level, it needs a lot of the instrumentation. It needs Droni. Droni is mandatory for the Dhara, and we need Dhara Patra and we need Dhara stand. Everything is arrangement has to be made. Siropich is another simplest procedure which can be easily adoptable in the cases like Anidra and the conditions with hair related conditions and even anxiety, you can adopt the seropichu. So this is very easily adoptable. The next thing is you can have abhyanga. So abhyanga is another major procedure because people thinks that panchakarma means abhyanga or panchakarma means massage. Very common people thinks that panchakarma means massage. So if you are not doing massage, they don't feel that it is panchakarma. That much familiarness is there, but it is not like that. Abhyanga is one of the procedure among the panchakarma. It is once again bahya upakrama. So Abhyanga is not a massage. The first thing we have to understand, Abhyanga is not equated to the massage. Massage is entirely different understanding and different concept is there. So here we are using particular medicine where the basic, the intention of the Abhyanga is to create the doshic balance, to create the pleasure, to create the very good sleep, to create, to prevent the degeneration or to create the rejuvenation. All these things are intention in the Abhyanga. So it is not only for relaxation, it is at the medicinal level, cellular level, it is effective. So which sneha you are selected, which taila you are selecting, because many of the massages you know that our it's our duty that by the Ayurvedic the graduates, so we have to give the proper awareness about the people about these procedures because commonly they think that massage and abhyanga is one another same because we have a lot of the variety of massages which are sometimes not acceptable, not scientific, and they are unscientific. So we don't discuss such things. We have to give an idea. Abhyanga is not only rubbing the taila over the body. We are applying taila and just to rub it. It is not the abhyanga. Abhyanga should be pleasurable to the person who is receiving it. So in such time, so you are taking care of the person's psychological and physical aspect, both things. It is very important. That's why you are starting abhyanga from first day very slowly, then gradually you ask the interact with the patient and understand his acceptance. Then you increase the pressure, you increase the velocity, and wherever the anatomical structures are there, you have to take care of such things because ultimately integrity of the structures present at any particular part of the body should not be disturbed because ultimately we have to support the integrity of the anatomical structures present in the body. That is intention of the abhyanga. That's why just to applying the taila, then you are doing very minimal movements over the body, it is considered as abhyanga. Because for example 80 years of age person is there, you are doing abhyanga vigorously, it will be harmful to him. You are damaging the internal structures of the body, then it is blaming of the Ayurveda. Means depending on the age of the patient, condition of the patient, the velocity or the pressure, then the selection of the sneha draga means taila, what you are selecting, it changes. Here also same thing. Whether you are adopting for the Brahmana purpose, you are adopting for the Vata Kapara purpose, you are adopting for the Vata Pittara purpose. For example, a patient with history of the neuropathy, diabetic neuropathy, that time you have to bother about the Sneha Dravya, which has to be selected. Or patient with the gout or the Vata Rakta, they have burning sensation, discoloration of the skin is there. That time you are selecting totally Vathara, it may not be effective. Totally you are selecting Vata Kapara, Brahmana Taila, it may not be effective. That time you have to select like Madhyasti Taila or Pinda Taila. Then that kind of the sneha is effective there. There you don't need much vigorous movements. You are just applying and you are doing abhyanga very gently. It is also effective there. Means abhyanga is mother of all the massages. Where in the massages, the techniques and the pressure effect and the vibrations, all those things are counted. But here in the abhyanga, not only techniques or the movements are important, with that the medicinal value is also very important. The medicine what you are using, the snehadravya what you are using, it is also very important there depending on the condition. For example, Amavata patient is there, rheumatoid arthritis patient is there, you can't do abhyanga there. If Amavata patient, you have multiple joint pain is there, swelling is there, redness is there, and you confirm diagnosis like Amavata, as we taught in our colleges studying in BMS. So Amavata is restricted for the Sneha. It is contraindicated for the Sneha. So if you are doing Abhyanga vigorously there, it worsens. The pain increases, swelling increases. Next step, patient will have the temperature, stiffness increases. There we have to select the Ruksha procedures like Valuka Sveda, which is very effective in the Amavata. That's why we are discussing Valuka Potli Sveda is highly effective in the Amavata, like analgesics. So you adopt the such kind of the things. Here in the Abhyanga also, you think about the condition. For example, a patient with history of the Katishula with radiculopathy is there, you confirmed and you observed the MRI LS spine. There is a disc problem is there. You are applying the Abhyanga with a lot of pressure. There is a chances of worsening the condition. That time you should be very careful about such things. Otherwise, once again, the contemporary sciences blames us. So these people are adopting unscientific treatments which worsens the condition. Means you have to think of these things. Abhyanga is another procedure where you can adopt the easily, effectively in the OPD level. And if you comes for the Shodhana procedures, Vamana is Virechana, Basti, Nasya. Among that, very simplest thing is Vamana can be adopted, but it may be difficult for everybody conducting Vamana. Even classical Vamana is not possible. You can adopt the Sadhya Vamana also. That I think it is difficult at the OPD level because it needs at least 2 to 3 members. And you can practice Virechana. You can practice like Sadhya Virechana, for example. Sadhya Virechana actually not classical version. Sadhya Virechana means we have, for example, Eranda Taila. Eranda Taila can be given for the patient. You ask the patient to have the Eranda Taila in the home only. One day, let them fast on the fast. Morning at 8:30 to 9 o'clock they can have. So recommended dose around 50 to 60 ml of the Eranda Taila can be given for the patient. Like Katishula, Gradrasi, Sandhigatavata, even in Amavata, you can adopt the Sadhya Virechana, where you ask the patient to be in the empty stomach and they can have the Eranda Taila around 50 to 60 ml depending on the condition, and ask them to have the lukewarm water on and off. Better to have little more temperature, so to facilitate the Vegas. On and off they should have the water sip by sip. Very important aspect in the whether it is classical Virechana or Sadhya Virechana is the water should be taken, huge quantity should not be taken at once. Sometimes because of the huge quantum of the water they consume after the, for example, Eranda Taila we're discussing, they will get the nausea sensation, they will omit out. Sometimes they will omit out all the Eranda Taila. Then Virechana Vega will not be appreciated. So you ask the patient to have the little by little quantum of the water. It facilitates the Virechana Vega. Up to evening, ask them to have the same procedure. After 5:30 to 6 o'clock, they can stop it. So maximum they will have the 5 to 6 or up to max to 7 Vegas will be appreciated in the patient. Patient will not have any complications usually. It is safest. Usually next day they feel lightness of the body, even their low backache will be reduced and stiffness will be reduced. Next, any treatment you want to plan, any Shamanaushadhi you want to give, you can adopt very comfortably. So this is another very simplest procedure you can adopt. If you want to have same thing in the Kushta also, any dermatological conditions, we have another thing called as Nimbamrtadi Eranda. We have Gandharvastadi Eranda Tela in the neurological conditions or the musculoskeletal conditions. In the dermatological condition, you can have the Nimbamrtadi Eranda Tela. That also can be given. Instead of the Gandharvastadi Eranda Tela, Nimbamrtadi Eranda Tela can be administered for the person, like at the OPD level, because classical Virechana, once again, it needs 3 to 4 days, Deepana Pachana, then Snehapana for 3 to 4 days, then Abhyanga Sveda 3 days, lastly Virechana comes. May not be possible at the OPD level, continuous having the follow-up of the Virechana patient for the 8 days. So this kind of thing can be modified and Sadhya Virechana can be adopted. And once you comes for the Basti, so Basti, in the Basti we can have the very simplest thing is Matra Basti. easily practicable at the OPD level, because we have, as we know, that Anuvasana Basti and Nirobasti, two kinds of the Basti are there, where Nirobasti needs preparation. We have to prepare the Basti, and it needs Panchakarma setup, because you have to monitor the patient. But where Matra Basti is the very simplest procedure and not having much complications, safest one, no much preparation is necessary. Because as my intention is, which are the very simplest way practicing at the OPD level, those things I am trying to discuss. So Matra Basti can be practiced very easily. You can have the glycerin syringe, 100 ml glycerin syringe can be taken. It is attached with the rubber catheter like Basti Netra, and you have the recommended thaila. For example, Sandhigata Vata patient. Popularly you knows that in the Sandhigata Vata, Gugulu Tikta Grita can be practiced. So you have Gugulu Tikta Grita around 60 to 70 ml. So that time we given Gugulu Tikta Grita for the patient for 7 to 8 days continuously. So no need of even Abhyanga Sweda also. Locally you do the Abhyanga Sweda enough. Sthanika Abhyanga Sweda for the Basti purpose. If it is your the setup is favorable, you can do the Sarvanga Abhyanga and Sarvanga Sweda also. It is not think that better you do the Sarvanga Abhyanga and Sweda, better effect will be there. But my point of discussion is easily simplify ways you can do the Sthanika Abhyanga and Sweda. Because another Sweda we have very simplest Sweda is Nadi Sweda, where bit difficult to conduct the Bhaspa Sweda. It needs that steam chamber, lying or the sitting steam chamber. It needs place. It requires some place. Nadi Sweda is another very simplest thing. You can have the cooker attached with a pipe, and that can be considered. Easily you can give the Sweda locally. Sthanika Sweda can be given very effectively, so that you can have the Sthanika Sweda and Snehana. Then you give the Matra Basti in almost all the type of the patients, neurological, musculoskeletal. You can have the, even in the IBS patients also, like gastrointestinal conditions like Changira Grita can be practiced Matra Basti with low doses, 40 to 50 ml. Changira Grita Matra Basti, because Matra Basti, as I am mentioning, and you know already, that it is very simplest process. Directly Snehadravya is administered, no need of preparation. You warm the that Snehadravya, lukewarm Snehadravya, then fill in the that glycerin syringe, and it can be administered. And no need of much restrictions for the patient also compared to the other basti, that can be practiced. And few other bastis, if you are interested, like Niro bastis, lot of the Niro bastis are there which can be practiced, but it needs a lot of the preparation. You have need some setup like Kalwa, everything is necessary, and Saindavalana, Makshika. So if any discussions are there, we'll discuss those such things. And Matra Basti is as in the Basti it is. And next comes for the Nasya. Nasya, you know that very simplest procedure, very common. For example, in the winter season, people comes with an history of Ardita or the Bell's palsy very commonly in the winter season. Another commonest thing is people comes with history of the migraine. Okay, then even sinusitis. You can practice the Nasya, because Nasya is Sthanika, Abhyanga and Sweda can be performed with Nadi Sweda only. Then you can have normal table, you can practice the Nasya. Recommended dose of the Nasya like 8 bindu, like 8 drops practically will adopt, or 6 to 8 drops you can adopt. If it is Marsha Nasya, you can instill in the nose. Each nostril has to be, procedure of the Nasya. This is another procedure very easily adoptable. Nasya can be practiced in the migraine and in the Bell's palsy, and even hair issues like hair fall, graying of the hair. So you can adopt the Nasya. And then these are the very easily adoptable procedures. For example, we have Anutaila, Shadbindu Taila, and Kshirbala Taila, and Dhanvantara Taila. The Kshirbala Taila can be adopted for the Brahmana purpose, even in the cervical pathology also. Then in the Shodhana purpose, if it is sinusitis, you can have the Shadbindu Taila, which is Shodhana in nature. Then we have Anutaila, easily acceptable. Even you can ask the patient to have for the Pratimarshanasya, daily they can have the Anutaila. So these are the procedures which can be easily adoptable. Those very commonly and easily adoptable procedures as we discussed. And if you have any discussion, it will be very easy to discuss.
Thank you,
Okay.
sir. So there are a few questions in the chat box. Shall I read it out, sir?
Yes, yes, please.
Okay. Sir, I think it was a question for Ishtika Sridhar. Can this be used for tendophysitis plantar fasciitis? This
We
one,
can use the
Ishtika
same thing
Sridhar.
I was telling. Plantar fasciitis only we can use it.
Okay, sir.
It is
And
effective.
any advice for gradually increasing weakness in motor neuron disease, sir?
Gradual weakness.
Yes, sir. Like any procedures
Gradual
that can
weakness
be
you can go for.
adopted,
Yes, yes, you
any
can adopt. First thing is you can adopt at the OPD level, you can adopt the very minimal urdhvartana. Urdhvartana should not be vigorously in the such. First thing is you evaluate by which reason there is a gradual weakness. For example, if it is as we discussed, lower motor neuron lesion, lumbar pathology is there, that time you confirm it. Nowadays we are having here and there some GB syndromes also available nowadays. A patient is comfortable, next day they develop the weakness in the lower limb, then gradually it enters into the upper limb also. So you confirm whether it is such kind of the condition is there or not. If it is GB syndrome, acute GB syndrome, don't touch it because it needs plasma therapy and the ICU management. Otherwise, it worsens. It go on worsens sometimes to be fatal. Once that plasma therapy and other interventions are completed, you can go for Urdhvartana. Then max best thing is Parisheka. Sarvanga Parisheka can be done. The difficulty in the Sarvanga Parisheka is it needs droni. On the normal table, you cannot have the Sarvanga Parisheka. That is a difficulty. That's why I'm not mentioned about the Parisheka Sweda in this session. So, but it is highly effective. Sarvanga Parisheka or Sthanika Parisheka can be done as the question is about the lower motor, the lesions or the lower limbs weakness. The Sthanika Parisheka can be done initially. Then you can have the Abhyanga, Sthanika Abhyanga. Very precisely, we can use the Sachara is more effective in the lower limb involvement. Sachara can be selected. Then you can have the Brahmana purpose, cystic shali can be done. Cystic shali also, Sthanika cystic shali Pindasveda also can be done. And next thing is option is Basti. As we discussed about the Matra Basti. In such patients, we can have the lowest dose of the Matra Basti. Usually what we'll do is the traumatic paraplegia, they will have the bladder neck symptom like they doesn't have control over the bowel and bladder. That time usually start very minimal quantum, like 10 ml or the 15 ml of this Nihadra we start slowly. So gradually they develop the sensation. It takes long time. If it is minimal weakness, if there is any incontinence of the stool, we can give up to 40-50 ml of the, depending on the age, we have to decide the dose. You can have the Matra Basti also in such patients.
Thank you, sir. So the next question is Basti on OPD level in various conditions.
Okay, this is from Ashwini Reddy. Okay.
Yes, one of our DGM alumni, sir.
Yeah, yeah. So as I think we discussed at the OPD level means same thing. Question comes about the how far practically we can practice it technically in the OPD level. That is important thing. If all the setup is there, we can have Basti, like we can have Madhyastic Shira Basti, Panchatikta Kshira Basti, Gestimadu Kshira Basti. So means why I am telling this kind of bastis, they are mrudu in nature. Usually Tikshna bastis may need observation. After the basti also they have to observe. For example, we have Eranda Muladi Niro basti, we have Manjishtadik Shara basti. They may need observation at the IPD level. It's better to select in the OPD level which are mrudu in nature, which are safer in nature. Brahmana in nature. So very common we can practice such thing. Like Madhyastic Ksheravasti is highly efficacious in the vascular conditions. In Vatrakta spectrum of conditions, it is highly effective. Usually we'll have Madhu, Saindavalavana and Madhyasti Taila and Mahatiktaka Grita and Kalka, Estimadhu Kalka can be used and Kshira Kashaya, Estimadhu. So this is highly effective. And even in the Amla Pitta, Adhogaja Amla Pitta, we can practice Estimadhu Ksheravasti once again. Then in the Sandhigata Vata or Panchatikta Ksheravasti can be given, which is once again mrudu in nature, but sometimes it will create excessive vegas for the patient. You should be very particular about the preparation. Panchatikta Ksheravasti can be given. And in the lumbar spectrum, Eranda Moladi Nirovasti can be practiced, but as I told that it is sometimes it needs observation because as we earlier discussed the bastis, they doesn't need much observation. They don't create such complications usually. They are safe. And for the Brahmana purpose, even we have Mustadi Apana Basti, where in the even as discussed earlier, once again in the paraplegia conditions or in the Pakshagata patients, for the Brahmana purpose, we can go for the Mustadi Apana Basti. Manjishari Kshara Basti, we can practice in the Amavata even and Vatrakta and even Pakshagata also. Only in the Basti, we have to think of it is not important that basti name, what basti we are giving, the what ingredients you are adding, it is very important. For what purpose you are adding. For example, Eranda Muladi Nirovasti. You take example of the Eranda Muladi Nirovasti. You are practicing, for example, in the Gradrasi. If you are practicing in the Gradrasi, so your selection should usually Sacharadi Taila or Dhanvantara Taila Sneha Dravya. Or you can add for the Vatanlomana purpose Sukumara Grata also in that. But if you change into the Mahamashatala, it will become Brahmana because Erandamula is Lekhana in nature, Deepana Pachana in nature. If you are adding Mahamashatala there, entirely the Basti becomes different. It will become Brahmana in nature. So, even you are practicing any Basti, depending on the condition, you have to decide the Sneha Dravya. Depending on the age factor, you have to decide the quantum of the total Basti. Depending on the dominance of the dosha, you have to decide about the how much madhu has to be added, how much sneha has to be added. If it is kapaja pradhana association with vata is there, then little madhu has to be increased. If it is vataja dominancy, sneha dravya should be dominant there than madhu. And in the proportion to the madhu and sneha, kashaya has to be added. For example, generally 400 ml of the kashaya and only 30 ml or the 50 ml of the sneha added, then it will become diluted basti. So I think in the OPD level also thus such kind of the things has to be considered. Then the proper proportion of the ingredients has to be managed. Then you can practice at the OPD level these kind of the few bastis effectively. But my opinion is very the comfortable basti is matra basti at the OPD level. You can practice in almost all range of the conditions. But wherever you needs Shodhana, that time you select the few Shodhana bastis as we discussed earlier.
Thank you, sir. Sir, one more practical question. Uh, what can you use the M sand if if sand is not available for Valukas Veda?
Valuka Sveda, if you Valuka is not available, you can use the even Lavan also, salt. Next option is you can use the Ishtika as bricks. You make it small pieces and you can use it. But best option is sand. So instead of sand, salt. Lavana can be used. Is it audible?
Yes, sir. Yes, sir. It's
Yes.
audible, sir.
Yes. Yes.
And next question is, um, in castor oil 50 to 60 uh, MO as a single dose or divided dose?
Single dose. Yeah, at a
Okay.
time,
After how many days we have to repeat Sadhya Virechana, sir?
Sadhya Virechana minimum once you administered, minimum you have to wait for the 15 days. You cannot give every week Sadhya Virechana because
Okay.
usually if you are conducting such repeatedly, it will create ati dosharana or sometimes patient will develop the habituation for it. So usually minimal 15 days you have to wait for the Sadhya variation. Repeatedly you cannot practice it because dose is very high. Even Erandathela can be given regularly daily, max to max 10 ml. 5 to 10 ml can be given daily as a Nitya Virechana or the for the Analomana purpose. But if you are giving 50-60 ml at a stretch, it cannot be practiced repeatedly. It will create habituation sometimes. It may not be effective. So minimum 15 days gap has to be given. And it is at a
Thank you,
stretch,
sir.
60 ml at a stretch.
Thank you, sir. So is Sadhya Vamana and Lagu Vamana same? What is Lagu Vamana?
Lagomana means it is something like Pruduvamana, Mruduvamana, we call it as. Mrudu means you are giving not dose is very limited and you are not conducting uh, the classical preparation is not conducted sometimes. But even after classical preparation like Snehana, Swedana, or like Snehapana, you are giving Mruduvamana means dose is reduced. You don't want to have Tikshna or the Tikshna Shodhana, what we call it as Tikshna. For example, you are giving 6 gram of the Madana Phala, here we are given only 3 to 3.5 gram of the Madana Phala. Vegas will be less, and patient will not be having more strain in the one. For example, patient is little old age or the patient strength is not so comfortable for the Vamana, that time we can have the Mrudu Vamana. Lagu Vamana means Mrudu Vamana. And Sadhyavamana is entirely different. Sadhyavamana is something where you can bypass the Purva karmas. You are not giving any Snehapana, you are not doing any Abhyanga or Vishramakala. On the day, suddenly you are conducting Sadhyavamana. Wherever there is a Utkleshan of the dosha is already ready to eliminate. For example, in the Amala Pitta, where the patient feeling nausea, suddenly you have the word Sadhyavamana. And Sadhyavamana can be conducted even in the later time also, like at the 9 o'clock, 10 o'clock also you can conduct. But classical Omana is one thing where you have to conduct at the early morning only in the Kapha dominant condition time only. That is the difference.
Thank you, sir. Which oil is good for Shushka Pratishaya?
Sushka Pratishaya is better thing is you go for the Anutaila because Shadbindu Taila is too much Tikshna in nature. It creates little irritation. And we cannot do the highly Brahmana also initially in the Pratishaya. Anutaila is better.
Thank you, sir. What is uh, in Ardita and hair fall, which oil is better, sir?
Ardita for
Yes, sir. In Ardita and hair fall.
Ardita, we can have the Kshirabala 101 or Dhanvantara Taila 101. For the hair fall, for hair fall, Nimba Taila can be used.
Okay. Thank you, sir. And there's appreciation from Dr. Geeta Puttur, madam. It was really a nice presentation. And in uterine prolapse in second degree, can you advise therapy, sir?
Uterine
Like
prolapse.
Panchakar?
Okay.
Yes,
So
sir.
it
Uterine
is it
prolapse,
is
second
difficult.
degree.
So because usually we can do only analomana kind of the things. Can do very minimal analomana kind of the things can be done. You cannot give the Tikshna Basti. You cannot give the classical Virechan also. But only thing we have Anulomana purpose because usually that kind of the patients will develop the uterine prolapse will increases because of the pressure effect, because of the constipation, because of the flatulence. So that worsens. You take care of the Agni, you take care of the so Anulomana, the proper bowel thing that can be done. You can give maximum some Matra Basti can be practiced, but few Utta Basti is difficult, but it needs surgical intervention sometimes. But only thing is Anulomana can be done. Few Matra Bastis can be practiced. Mrudu Bastis can be given.
Thank you, sir. And in osteoarthritis, Nirama Avastha, which oil we can tell patient for Jan Pichu?
Jano pitch, okay. It is also very good thing. Is a modification of easily comfortably you can adopt. Jano pichu, Brahmana purpose, you can have Ketaki Muladi Tela, then even Mahamasha Tela can be adopted.
Thank you, sir. And in diabetic neuropathy, which taila is better for Abhyanga?
Diabetic neuropathy, Dhanvantara Taila. And then another, the best Taila is Himasagara Taila.
Thank you, sir.
Himasagara Taila effectively manages diabetic neuropathy. The burning sensation comes down.
Okay, sir.
Then
Thank you,
another
sir.
Taila is Prabhanjana Vimardana Taila. Specific Taila is
Prabhanjan.
Prabhanjana Vimardana
Oh,
Taila.
okay, sir. During which, during Virechana procedure, whole day Langana should be followed, sir.
During the Virechana, yes, since morning they should be on the fast only medicine and the Anupana like water has to be administered. Up to evening, they should not have anything other than water.
Thank you, sir. In urine incontinence in ladies, which oil should be used for Matra Bhakti?
Sorry,
In urine incontinence in ladies, which
huh.
oil is better for Matra Bhakti?
Urine incontinency. Okay,
Yes, sir.
you can have the Vastayamantaka Grita. It is available. Vastayamantaka Grita is available. Only I think Kottakkal is available nowadays. It is best. And next easily practicable is Dhanvantara Taila. Matra Basti. Okay, we can give Vastayamantaka Grita or Dhanvantara Taila. It needs Vatan Lomana in incontinency.
Thank you, sir. Any advice for chronic tonsillitis, chronic sore throat to avoid surgery?
Surgery, if you want to avoid, rather than Panchakarma, we can have the immunomodulatory drugs has to be given. So we need food restrictions, we need some lifestyle modification, and we have some Shamanosiris are effectively manages these things. We can have the Dashmula Katatra Kashaya or Indukanta Kashaya rather than procedures. The best of best is if he is adult, we can have the woman once again. If he is repeatedly occurring, you can do the Mrudu Vamana. The question was the Lagu Vamana or Mrudu Vamana. That can be done. Then afterwards, you can have some immunomodulatory drugs can be given, like Agastya Rasayana. Then you can have the Dashmula Katutraya Kashaya or Indukanta and Sukumara Kashaya can be given. That is a better option.
Thank you. Thank you, sir. What is the utility of Agni Lepa?
Agni Lepa is for the purpose of Amapachana. In few centers, they are practicing it. Drugs are there which are Ushna, Tikshna, and Ushna Viryatmak drugs are there. They will be applied. Kalka is prepared and it is applied all over the body or locally. It helps for the Amapachana. So now what we are doing in our practice or in our institute is we'll do the Parisheka. For example, very common thing is we use the Dashamula Kashaya Parisheka for Amapachana or the Sama conditions. So they will apply for the Sama condition. So they think that Amapachana takes place.
Thank you, sir. Sir, what about OPD level Rakta Mokshana?
Rakta Mokshana can be practiced at the OPD level. Another thing, Jalavka can be practiced very comfortably as it is a localized treatment. If you are having interested to store the Jalavka and maintain the Jalavkas, you can effectively manage all the dermatological conditions. Even a few musculoskeletal conditions also are very specifically vascular conditions. You can have the Jalavka like deep vein thrombosis, varicosity. You can practice in dermatological like Vicharchika, and you can practice the Jalavka. It is very easy method. Procedure, I think, I don't think I have to explain everything. Jalavka can be practiced. Next thing is Siravada. If you are skilled, you can practice Siravada, but it needs skill.
Okay, okay. Thank you, sir. And in Agni Devana needed, is Agni Devana needed before Matravasti? Shantala madam, could you please?
Madam, that is Agni Deepana, madam, spelling mistake.
Yes, yes.
Yeah.
It needs one.
I'm sorry.
I got it. So for the Matra Basti or any procedure, there is a need of the Agni has to be analyzed and assessed. For example, a patient is of 70 years, he is not fit for the Neurobasti, you want to practice Matra Basti there, but Agni is not correct. Agni Mande is there, or Sama condition is there. Then don't go for the Matra Basti even suddenly you have some dipana pachana or rukshana in the sense, then you give the matra basti, it is more effective. Any treatment modality in the panchakarma, better plan for the dipana pachana, the rukshana first, so it will prepare the body to accept it. Then you administer the matra basti, it is more effective, because as we are administering sneha dravya, if the agni is not normal or sama condition is there, that time you are giving matra basti, the effect will be compromised. You have to give the dipana pachana.
Thank you, sir. Sir, for what can be given for chronic constipation?
Chronic constipation, the thing is you can give the, once again virechana can be given if the patient is fit for the virechana. Classical virechana has to be conducted. After that, basti can be planned. If the person is old age, you can have the basti. Once again, matra basti. The better selection will be matra basti, because ultimately constipation is one is yes factor, another thing is agni disturbance. There is a need of vatan lomana. So you can have the matra basti. For example, sukumara grata is there. You can have the sukumara grata matra basti around 50 to 60 ml. At the age of the 70, 75, even you can administer. And if the patient is around 45 to 50, you can have the virechana. Classical virechana can be done. Then you can have nirobasti also. But better option is, once again, chronic constipation needs agni correction. Diet has to be explained very well, so that easily digestible food, liquid food has to be advised. Then lifestyle has to be changed early to be bed. It is very important. Then psychological stress has to be managed. Then you can have the matra basti. You can manage the constipation.
Thank you, sir. What best therapies can be given in sciatica cases at OPD level?
Best thing is katibasti patrapoti svela. And next option is basti. The best thing is katibasti. Easily adaptable. No much preparation is needed.
Thank you, sir. Sir, I think one more question regarding uterine prolapse, the same, like which taila or for Uttarabasti advisable, and will it really avoid surgery?
No, actually, I
Which
don't have
taila is advisable?
experience in that area, because I am not uh, consulting such the patients.
Sir,
There are
to
people
add
say,
to this, to
sorry,
add to this, yes, sir, there is like one Udumbara Taila described, sir.
hmm.
So that is the best advice for this uh, uterine prolapse, sir. Sorry for
Even
interrupting this.
classical references are there. Even classical references are there. Moshika Taila is there, which is highly effective. They are explaining. But as per
Yes, sir.
my knowledge is concerned, I am not having exposure toward that.
Yes, sir. Yes, sir. Thank you, sir. And in diabetic neuropathy supti, that that time which oil we should use oil
For what purpose?
in diabetic neuropathy supti numbness probably, sir.
No, no, for what purpose? Abhenga, Basti, what actually?
Maybe for Abhenga only, sir.
Abhenga we discussed already. Prabhanjana Mardana Taila, Himasagara Taila.
Ha. Yes,
There was a
yes,
question
yes, sir.
previously.
Yes, sir. Grahin
Sorry, sir.
in
Sorry, ma'am. So you have told if burning is there, sir, Himasagar you told, and when Supti is there, what we have to use, sir?
Shukti is there, you can use the Sacharadi Taila.
Okay, sir.
Sir, namaste. In
thank
cases of thyroid and prameha, what type of basti can be given, sir?
In thyroid and the prameha, same thing. We have to consider it as a Kapha Vata condition. You can have the Vamana. Next thing, before the Vamana, you can have the Udvartana. But kindly mute yourself, please. Urdhvartana can be done first. First, I think is Rukshana has to be done. Urdhvartana has to be done. Then you can conduct the Vamana in the thyroid condition also, because kapha dominance will be there. In Prameha also same thing, as I already mentioned that if it is Stula Prameha, we have the Urdhvartana and Vamana can be done even, because here Vamana is not the purpose of only removing the kapha, we are trying to correct the metabolism. See here in the diabetes or the Prameha, According to Ayurvedic understanding, we are not focusing on the reduction of the glucose level. We are trying to create a healthy environment in the body to manage the or to control the glucose itself in the body. We are not forcing to control the sugar level or the glucose level in the blood as far as the diabetes is concerned, because anti-diabetic drug will forcefully reduce the glucose level. But here we are not attempting for that. We are trying to attempting reduce the insulin resistance. We are trying to increase the potent insulin release in the body. We are trying to increase the metabolism. That is our understanding and the basic concept in the diabetes, understanding in the Prameha concept. So it increases the quality of the life of the person. Even in the thyroid also same thing happens. After conducting the Urdhvartana or the Vamana, suddenly TSH value may not be reduced, but gradually it comes down, but the quality of life will be increases. They feel lightness, their mood swings will comes down, they become active, their weight reduction takes place gradually. So such kind we can expect.
Thank you, sir. Sir, in Grahani Muhurdrava Muhurbadda, which matra bhakti is advised or it is
Chandyaradikrita, I
advised?
was mentioning last question only. Chandyaradikrita is ideal.
Sir, in Krusha Prame, what basti can be given?
In Krisha
In
Prameya
Krishna
also,
Pramani, what bhakti?
we will complete this first. Chandyaradikrita can be given for the Matra Basti. Then we have modification of the Basti card as Takra Basti. Even Takra can be used as the Kashaya for the Basti. That can be given. And we have Picha Basti. The best thing is Chandyaradikrita Matra Basti is ideal. And sir's question was about the Stula Pramehi. Stula Pramehi, we can use
Krishna,
the, sorry?
Krishna
Okay,
Pramani, sir.
Krisha Pramehi, sorry. Krisha Pramehi, we can need their Brahmana, but suddenly we cannot do the Brahmana as it is Prameha. It is Kapha Pradhana and Meda will be involved. So once again, we need very gently how to manage the person. You can have the Parisheka and you can use the Basti like Madhu Tailika Basti. We have Basti card as Madhu Tailika Basti, which is Apana in nature. It is Apana in nature, but it is effectively manages it in the indication in the text is also in the Prameha. In the Prameha, we get very minimal bastis. Among that, one is Madhu Tailika Basti, where Madhu and Sneha is highest quantum. We very specifically use the Murchita Tilataila only can be used. So that Madhu Tailika Basti is ideal for the such kind of the person.
Thank you, sir.
Thank
Sir,
you, sir.
these
Thank you
days
very
with
much.
the yes, sir. These days, Vidya Karma is becoming very common. Does it really have any scientific explanation?
With the karma,
These days, Vidya Karma is becoming very common, common practice actually. So, does it really have any scientific explanation?
yes. So these are having scientific explanation is it is, for example, the procedures usually adopt for the purpose of stimulatory effect. So like with the karma is also having some effect, like some points will be considered and there the stimulation will be given. So that will create a lot of the changes in the internal environment. Particular organs will be get stimulated. So where you are doing with the karma. So that is the thing. Even another version is, for example, Marma Chikitsa. People practice and even Ayurvedic version also there. So Marma is the point where actually the sum of the points are identified, which are vital in nature. The union of the many structures will be there. If you have stimulation over it, whether you are doing stimulation by any means, that will create a lot of the stimulus transformation and that stimulates the function of the most of the organs related with that. That is having its own impact. But with the karma is not only the complete treatment that we have to understand.
Thank you, sir. And Nasya best timings and for how many days to be given, sir?
Nase is morning only, around not early morning. So you can give at 8 to 10 o'clock in between. You can give for 7 to 8 days. 8 days is maximum.
Thank you, sir. Sir, for Deepana Pachana, what are the common drugs that can be used?
You can give Hingvastaka Churna, you can give Panchakola Churna, Panchakola Sava. Okay, these are very commonly practiced. Hingvachadi Churna or Hingvachadi. Now Hingvachadi tablets are available. Hingvachadi Gulika. Even Shadharana Churna. These are you can use.
Sir, Kotamchika, the oil can we use in Samavastha?
But not purely Samavastha. In Samavastha, absolutely Snehana is contraindicated. You know that. But if you are doing up to some extent Rukshana, but still Sama is remained, that time you can use the Kotumchikadi Thaila. First selection will be Kotumchikadi. But not purely Sama condition, you use the Kotumchikadi. For example, as we discussed already, Amavata is a Sama condition. In Amavata, if you use the Kotumchikadi Thaila, it worsens the condition. But chronic Amavata you can select. That's a different, once again, different condition. But Sama, absolute Sama condition is contraindicated for the any Sneha, even Kotumchikadi also.
Thank you, sir. Sir, in Fisher, what can be done?
Fisher main thing, one thing. Fisher usually it repeats wherever there is a immunity compromise, compromisation also it enhances. Once again it worsens. Main thing is Agni correction. Then the proper separation of the Sara and Kitta means stool formation should be proper, because usually because of the constipation and because of the Agni disturbance it worsens. So you have to take care of the Agni and digestion and bowel. So Anulomana type of the drugs has to be practiced and Agni should be maintained properly. So then the Sthanika Chikitsa can be done, like for example PANCHAKARMA, those kind of the treatments can be given. But even though if you are not managing Agni, you are not bothering about the digestion and metabolism, then it worsens and it repeats most of the time. That's why first thing is you have to bother about the diet, then their lifestyle, then about the Agni has to be maintained properly. If there is a indigestion, if there is a constipation, if there is a flatulence regularly, that will worsen usually. So that's why such kind of the things has to be considered even in this condition.
Thank you, sir. So,
Sir, one more
how
question,
many
sir.
years?
Sir, one more question in regarding Gridrasya, Vata Kapaja Gridrasya or Vata Gridrasya. Basti, which basti you can prefer?
In Vata Kapasa Gardrasi, you can have the Erandamula, very easily practicable is Erandamula the Nirobasti. In Vata Gardrasi, you can have the Dvipanchamula, the Panchabasti,
The
which is
Panchamula.
Brahmana in nature, mentioned in Charaka.
Anand sir,
days you
please
can use
mute
that?
your mic. I think you can type because there's a lot disturbance from your side.
Okay, sir. How many days you can give the basti, sir?
Or usually you have Yoga Basti, Kala Basti, Karma Basti pattern is there. Minimum is 8 days Yoga Basti, 5 Niro Basti, 3 Niro Basti and 5 Anuvasana Basti.
And in case of Astikshaya,
Astikshaya is where it needs little longer
Osteoporosis.
treatment. So we can have the Panchatikta Kshira Basti. Ideal thing is, even old age persons, you can practice Gugula Tirtha Grita or Panchatikta Gugula Grita Matra Basti can be practiced. Matra Basti can be even months together, even no issue in that. Very minimal dose, for example, 40 to 50 ml, you can give for 16 days or even 20 days for the 70 or 60 years of age. But if it is at the 45 to 50 years, you can practice Panchatikta Kshira Basti for 8 days. Then you stop, have a gap for 16 days, once again you repeat it.
after 15 days you have to stop and again restart, sir.
You can repeat another course, then you have to stop. Not like every 15 days you have to practice. You cannot do the Nirobasti repeatedly. Then switch on to the Matra Basti.
Okay. Thank you, sir. Thank you very much.
Yes.
Thank you, sir. So, for how many years old Prameha can be treatable?
So it is not year, it is not the question about the chronicity. My point of understanding is it is the question of patient strength, patient the pathology, how much it is worsened. It is important. For example, if the patient is managed very well, he is having history of 10 years, for example, their general health is very good, you can effectively manage it. If the person is of 2 years of history of the chronicity of the diabetes and they are not managed effectively, they are already vital organs are having little variations. For example, renal involvement came, creatinine is gradually increasing, or liver pathology is disturbed, then it is difficult. It depends on the patient's thing, because few people are there where they will manage because of their lifestyle effectively. That very easy, because how much internal environment is healthy, easily you can manage it. For example, first time when it is diagnosed, their glucose level is 450. For example, a person's 450, then they are badly managed it. They are not properly uh, followed the diet, followed the lifestyle. Within 6 months also, they will get very huge complications. So it not the chronicity. It depends on the individual's health and individual's the management of their glucose level, their internal organs, how much it is they maintained very well. That's very important. What my understanding is.
Thank you, sir. So if we are adopting both Shirodhara and Nasya, which procedure should be adopted first?
First will be Shirodhara, then Nasya.
Okay, sir. Any procedure to be advised for erectile dysfunction?
Yes, you can have the Virechana first, or at least Sadhya Virechana. Vatan Lomana is necessary. Then better thing is Brahmana Bastis or Vajikarna Bastis are available. Those Vajikarna Bastis can be adopted.
Thank you, sir. Dr. Ujjwala, do you want to ask anything?
Yes, ma'am. Sir, it's a really wonderful session. Thank you so much. And I have to ask, like many old ladies have hairline fractures, okay? And
Yes.
allopathy doctors, they told, many patients came to me and they told, you have to be like that. It will not be healed. So these patients, we have to give matra basti or like gandha tela internally or shirabala, like ushna snigdha chikitsa or shita snigdha chikitsa, which one we have to adopt if they are not ready for basti, and which basti we have to use, or any one not one like avarti tela we have to use internally.
Internally, okay, we can use the Gandhathaila as we are mentioning. Even you can do the Murugana, you can do the Vestana. Ask the patient how the Vestana about the Murugana Thaila. Or Kaya Tirumani Thaila is available. You are from, madam?
I'm from Bangalore, sir.
Okay. So Murugana is available. You can dip the Murugana Thaila in the cotton cloth and you ask them to have the Vestana. Just wrap it over the wherever the fracture is there. One thing. Second is even you can do the Murugana Parisheka can be done. Ask them to have the Parisheka. Just pour the Murugana Thaila over it. Or even next option is Dhanvantara Thaila, very easily available. This is very simplest thing. And even you can ask the patient how the instead of the Gandha Thaila, Gugulu Tikta Grita can be given orally, like around 5 ml, 1 teaspoon of Gugulu Tikta Grita. Twice in a day, you can ask them to have orally as a Shamana Sneha, very minimal doses I am telling, 5 ml. With milk, it can be given. And next option is Basti is there. You can have the Basti, Matra Basti. If the patient is not ready to Basti, better thing is you go for the Vestana of the Murugana and you can have the Parisheka of the Murugana. You can do it.
Sir, basti same na, like Gugul Tikta Gruta.
Gugulu Tiktakrita Basti, you can do it.
If sir Pittanubandha is there, which
Madhyashti Thaila is best. Because Yashti Madhu is Sandhana in nature. Madhyashti Thaila is very best in such conditions. Madhyashti Thaila Basti can be given. Even another aspect is you can have Yamakasneha. Yamakasneha like Mahatiktaka Grita and Madhyashti Thaila. Both you can mix equally. For example, 25 ml and 25 ml each. Old age persons you can give maximum 40 ml, 20 ml each. Madhyashti Thaila 20 ml and 20 ml Mahatiktaka Grita. Together you can give Yamakasneha like Matra Basti. It is effective.
Sir, can I ask one more question?
Yes, please.
So, sir, I have a patient. She's a 60 years old female and chronic constipation. Okay, she will be having very hard stool. Sometime 2 days. Her she has a pre-diabetic condition with fatty liver like Santarpanjanya, and this fibroid uterus it was removed, and gallbladder polyp. It was gallbladder stone, so that also removed.
Multiple things are there. Okay.
Multiple, sir. So much of pitta dushti because
Yes.
she is Marwadi, so that rakta pitta dushtikara hara was there. So I have given her lagu hara. She's following very nicely, whatever I have told. So still her constipation is not corrected. I have started her Arogya Vardhini, and when I started, because so much of Rukshana, initially I gave Vipatti and Gandharvastadi Kashayam. So it was not reduced. Then I started with Trivritta Leha with Anuloma DS. These two medications she will be having, means if I stop that, again she will develop that constipation. But her ahara is very light now. She has corrected. She reduced 5 kg also. And whatever I am telling her, she is following. But still her constipation is not corrected, sir. What to do?
Gandharvastha, Erenda Taila is administered.
No, sir. Only tablet I have given.
Okay,
So,
Erenda Taila you can. One thing. Second thing is you can give Patola Katakuro in the Kashaya because there is a need of from the Ekrit also it has to be corrected. Metabolism is disturbed there because he is having issues like cholelithiasis is there, pre-diabetic is there, metabolism is disturbed. So better option is Patola Katakuro in the Kashaya because it is Mrudu Virechaka and it corrects the Agni and it is Vatanloma in nature. One thing. Second thing is you can use the Erenda Taila also, but as you mentioned, Trivrutliya with Anuloma, I think she is having uh, long history of the chronicity of the constipation is there, but it takes time. You start Erenda Taila also daily, regularly, minimum 10 ml night after the food or just before food 1 hour prior to the food with lukewarm milk 10 ml Erenda Taila because we need to increase the snigdha guna in the body also. As you mentioned, she is having Ruksha Pradhana and old age, Vata is also dominant there. So both the things has to be handled. So you can have the Erenda Taila. Gradually it will it can be corrected up to some extent. As you mentioned already, she is following diet also. Thing is, Patola Katakurina the Kashaya, then Erenda Tela overnight you can administer. And even you can have the Erenda Tela, Gandharvastha Erenda Tela Matravasti also can be given. Around 50 ml.
okay, sir. And she is mentioning now after getting up, she is feeling like pain, stiffness is there. But I don't know, sir. She's following Langana. Why this stiffness is coming? I'm not understanding.
It is because of the Vata dominancy only. Rukshata is increasing in the body. So because of that, she is developing stiffness, even though Kapha is not there. But it is due to the Vata only. Rukshata is dominating. That's why better thing is you do little Snehana also there.
Okay, sir. Sure, sir. Thank you so much,
Right.
sir.
Thank you, ma'am. Would like to take the last question that is at OPD level, Panchakarma practice for BPH cases. Sir,
Yes,
Panchakarma at OPD level for BPH cases, sir.
BPH.
Yes, sir. Yes, sir.
So BPH once again you can have the Matra Vasti. Like Sukumara Grita or Vastayamanta Grita. Presently I have 2 cases now. They are going on. Vastayamanta Grita Matra Vasti because usually you know that it is a senile condition. So you can have the Matra Vasti and you can, if they are fit for the Nirobasti also, you can practice Varnadi Kashaya Nirobasti can be given because there is a need of little Lekhana also as it is a prostate enlargement, but it should not be too much Tikshna because the more Tikshnata, they will be, the condition will be worsens because Vata Prakopa takes place. Better option is Matravasti can be given or Mrudu Virechana can be done with Erenda Taila for the Vatanlomana purpose first, then you practice the Matravasti. Matravasti is effective. Even few researches are also conducted in our college also. So Matravasti can be given. The widening of the urine will be increases and post-viral urine quantity also reduces. Dysuria also comes down gradually you can practice Matra Basti. One is Sukumar Grita, second thing is Vastyamantika Grita.
Sir, Matra Basti can be given in Ama conditions also?
No.
They have to do it Nirama and then only.
Yes. Because it is Snigdha, because it's Sneha only, it worsens the condition. Sometimes they feel heaviness of the abdomen, loss of appetite.
Mm-hmm.
Sir,
Thank you, sir.
recurrent renal colic, what we have to do after correcting the Agni, Matra Basti, and with BPH, Matra Basti, can we use same Basti Amayantaka Gruta because our Pidak and so we mentioned, so can we use Matra Basti? The patient is having recurrent renal stone condition.
You can use it, but better thing is once again same thing. We have very good Samnausades in the Mutrashmari rather than procedure. The first thing is you can give better option is Avagaha, but it is difficult to maintain at the OPD level or the Mutrashmari. You can have the Nirobasti. Once again, Varanadi Kashaya Nirobasti has to be practiced. Once again, one study also conducted at the Panchakarma Department PG. I think in Hubli only. Varunadi Kashaya Basti is practiced for the Mutrasmari. Because here repeated formation of the Mutrasmari is due to that the composition has to be changed. So Varunadi has to be given. Varunadi Nirobasti can be practiced.
And for Anuvasana, sir, which oil?
Anuvasana Vastyamantakrita is better.
Thank you, sir.
Thank you, ma'am. It's almost 10:40. I think it's really a long time. Sir is online, and it is such a vast subject that you really it needs a great experience and a dedication to handle such queries, such topic. I wholeheartedly thank from on behalf of all delegates and our Millennium Batch for choosing such topic on that too online basis. You made it so easy, and of course, today many of us have collected the points that can be added to our OPD level practice, and truly there are many appreciations coming your way, sir. Please accept those appreciations, and we really it is almost time up now. So with saying thanks to everyone, especially Dr. Jairaj Basrigidat sir for his wonderful explanation regarding Panchakarma on OPD basis and interactive session. It was really very interactive. Obviously, everyone will agree for that. And I thank Dr. Manjula for introducing guest speaker. I thank our Dr. Praveen for managing all these records, maintaining all these records, and I thank all my Millennium Batch friends for being there to support you, and thanking the principal sir, present principal sir, Santosh Balwadi sir, and our former principal sir, Dr. J.B. Patrick sir, for being so supportive for in all such this one session. So with this, would like to wind up the session saying good night to all. Thank you. The same sessions will be continued as if your support will be there. So saying thank you and good night to all. Thank you, sir. Thank you so much.
Thank you very much.
Thank you, sir.
Good night.
Really very appreciable, sir.
Thank you very much.